You're listening to Health Radio. It's time now for Health Beat of America with Rochelle Herman on Health Radio. Now, here's Rochelle.
Hi, everyone, and welcome to the program. Today, we are going to be starting off with non-surgical cosmetic treatments, how they're growing in popularity. And with us today, we have Dr. Lori Brightman. She is a board-certified dermatologist and specializing in Mohs micrographic surgery, dermatological surgery, cosmetic surgery, and laser surgery. I'm going to be talking with Dr. Brightman here. If you have questions, please feel free. You can email me at rochelle@healthradio.net. And welcome to the program, Dr. Brightman. Thank you so much for joining us.
Thank you for having me.
I will tell you that cosmetic treatments in general are what mainstream public are really looking for, but to do something in a more of a non-invasive, non-surgical manner, I understand that this is really has increased in the demand in the growing popularity. Tell us what you've been experiencing in your office.
Well, we do both non-invasive as well as invasive procedures, and we certainly have seen in our practice a growth in the demand for non-invasive procedures. And I think the reasons are multifold. There's those folks who really just can't take that time out of work. There's the moms who really can't take the time out of not being with their kids. There's the economic concerns with, more recent contracture in our economy that people just really need to be sure they're ready to roll if they get a new job or, not taking time out of work. So I think it's, many reasons why people are choosing these minimally invasive or non-invasive procedures to really help them maintain the youthful look that they're, going for.
Mm-hmm. Well, without sounding cliche, we all do want to be able to put our best face forward,
Yeah.
Especially in this economy when there's so much competition out there in the workforce, for example, and it is a self-esteem booster. Share with us some of the research that you have been focused on. I understand that you're currently involved in the use of laser and light devices for the treatment of not only cosmetic conditions but medical as well. Can you share with us what the pros and cons of this particular procedure would be?
Sure. I mean, I'm sure anyone listening would understand there's a multitude of devices on the market. And my goal and our office, our goal collectively is to take these devices and really help define which treatments are best and for which indications, or perhaps, what would be the most ideal treatment parameters for that particular device. Radio frequency happens to be an energy source that is becoming more and more popular. It's something that can be done with minimal downtime. There's different body parts that can be treated, different indications that can be treated. For example, it can be used for rejuvenation, sort of reducing those fine lines, wrinkling, laxity on the face. And then I use it on the body to help improve stretch marks, or I actually am even, looking at a clinical trial in helping improve the port wine stain or red birthmark. So it's interesting to see, these multitude of different treatment indications with one device.
Mm-hmm. Well, now, where the person, the individual who they want to be able to start, really looking at themselves more closely, what type of, and almost like an interview process, do you provide to the patient to see that you are both, on the same plane and really moving forward in really a positive manner for certain changes?
I think that's a good point you bring up. I really think it's so important for the patient to come meet with their doctor who would be providing their services and be sure, even before going, that this is someone that is well-skilled in laser procedure, cosmetic procedure. You want to make sure it's someone you're comfortable with, so when you meet them, that's another thing you're looking for. And also being very clear with your doctor, what are your goals? Are your goals to simply, get a refreshed look on the face, or perhaps you just had a baby and you have some stretch marks on the abdomen that you want to treat? Regardless of what the indication is, your doctor would then be able to go over with you what would be the ideal treatment for that indication, whether it's, reducing those wrinkles or, improving the tone in your facial skin. And, your doctor would be able to go over the details of each procedure and what you could potentially expect for results.
Mm-hmm. Now, what do you find to be most satisfying in your practice when you are addressing these concerns with the patients?
For me, my most gratifying procedures are when I have a patient who comes in and, she tells me or he tells me, this is what really bothers me. Perhaps it's around the eyes. And I'm able to do a very simple procedure. I'll give you an example, like Matrix, which is one of the radiofrequency treatments I was mentioning. There's minimal downtime, yet I'm able to provide them with a nice result that doesn't require them to be out of the public eye, so to speak, or out of work. And you're able to improve what bothers them, but without taking them out of their life for, several days.
Mm-hmm. It's quite obvious that you're enthusiastic about these specific procedures, the technology that we have set before us. What do you see on the forefront moving forward? Because it does, what comes out into the market with technology is, it's as quick as a flash. And so I'm curious to know what you might see that is soon to be presented that you might be incorporating in your practice.
You're very right. This industry is growing at a rapid rate, and a lot of patients will come in and not even know where to begin because there are so many devices on the market. And again, I think it's critical for someone to go to someone who is really well skilled in all these procedures, because that's what gives you the ability to have a procedure that best suits you. In terms of what's on the horizon, there's a lot of fun stuff to come, and a big part of that will be further development of fractional radiofrequency, taking that device and using it in different indications. Body contouring is a whole nother section of our industry, which we're using a lot of non-invasive technology to help patients improve the appearance of different parts of their body, to help tighten maybe a little lax belly, or perhaps improve the saddlebags. And I think that's an area in our market we're going to see more and more very interesting devices.
What would you say as far as, typically when you're thinking about, cosmetic surgeries, we're thinking, primarily women will be seeking out these alternatives. What do you see as far as the men? Are there more, have they increased in their desire to be able to stay youthful looking as well?
Oh, for sure. That is definitely something we've seen on the rise. And actually, the recent data that was published from the American Society of Plastic Surgery showed an 8% increase of men seeking cosmetic procedures. So even the proof is there.
It's incredible. Now, what would you recommend as a physician? There's the young folks, parents of teenagers. Teenagers want to be able to, improve their looks. When is it time to really take a step back and, is someone too young at a certain age? What have you experienced? Because I'm sure that you have had the situation present itself in your practice.
Yes, that's definitely true. We do see that. And, this is a very gray area. And the reason I say that is because the answer is going to be different for everybody. I think the overall message should be, for younger folks, teenagers in particular, you're still growing. You're still learning who you are and what you do and do not like in life, let alone about yourself aesthetically. So I think the more important part is not which age is appropriate or which cosmetic procedure is appropriate. I think what is appropriate for that individual, and that would be, very open and honest conversation between parent and child, between doctor and, parent and child. The majority of my pediatric patients are here for birthmarks, which is something that can actually potentially medically cause problems. And that's the focus for me is for these pediatric patients is to help them improve something that could potentially, be medically concerning. It certainly has a cosmetic component to it, but I'm treating the medical indication.
And I will share with you, you're speaking to a mother who has had just that with my daughter when she was born, and she has had the laser surgery every 2 months for her entire life, and she's 13 years old. So there are certain situations I'm very impressed with the work that you provide, and I'm thrilled to have you on the air with us today. I would like to be able to give those in the audience an opportunity to educate themselves more, perhaps on your website, laserskinsurgery.com. In final message, what would you like to share with our audience today?
Again, I think everyone gets to put their best face forward and be sure to seek someone who is the best at helping you do that.
All right, excellent. Dr. Lori Brightman on the air with us right now. Check out the website, www.laserskinsurgery.com for more information. Dr. Brighton, you're welcome back anytime. Love to be able to have you here again as a guest.